Okay, let's go back to, I'm so sorry for a little here and there happening in the class. Let's go to the part where we were. For anterior teeth or anterior tooth, your offending tooth has significant coronal damage, undermined marginal ridges, loss of incisal edge, coronal fracture, and it is aesthetically unacceptable to the patient. Then what do? You will have to go for a either you will have to go for a full coverage crown, definitely, but how do you support that crown? You need something to reinforce that tooth, and for that reason you can go for a custom made or prefabricated post and core treatment. In the last class I told you, in no way post will strengthen the root or the tooth. In no way post will increase the strength or reinforce the root. No, it is not doing that. The post is actually supporting, it is actually strengthening the core that you will give on top of it, right? So in cases of a small circular canal, you can go for a prefabricated post, as in prefabricated, the already formed post, already formed rod-shaped structures that are commercially available. You can go and pick your size for the canal and go about it. But in cases of flared canal, you will have to customize, you will have to adapt to the root canal anatomy. In simple words, you will have to make your own post, right? In cases of posterior tooth, what are your options? Depends again on the cuspal coverage, right? Sorry, depends absolutely on the part where you have to take care of the masticatory load that the tooth will undergo, and that is why cuspal coverage in cases of posterior tooth is mandatory. Okay, this is a major difference between anterior and posterior teeth. Then we have, in case minimal coronal damage has occurred and there is low risk of fracture, minimal occlusal forces, intact buccal and lingual cusp, what do you go? You can go for a conservative treatment, minimum MOD only. I described the only in the last slide today, extra coronal restoration, where you have to you have to cover the cusps. That is it. You don't have to fully encircle the tooth with a full crown. In cases like these, you can go for a mesio-occlusio distal only without any post. Right. Next, we have moderate coronal damage. Minimum of one sound cusp or extreme root curvature is present, then you can go for an amalgam corono-radicular core or resin composite core followed by a full coverage crown. This is no rocket science. In case of moderate coronal damage, which is there in 99% of the cases when patient comes to you with a posterior tooth, in 99% of the cases, if it's an easy case, the dentist, you yourself, what you're going to do, you will provide a post endodontic restoration, which means endo करने के बाद, रूट कनाल करने के बाद, उसके लिए एक तुम restoration करोगे next visit में, and उसके बाद तुम उसकी tooth preparation करके you will provide a full coverage crown, right? That is what is done in 99% of cases, the one which are not complicated cases. Significant coronal damage has occurred. Now what do? Little or no remaining coronal tooth structure is there. Now, this is exactly what I'm trying to tell you, little or no remaining coronal tooth structure. Actually, students who actually attended my last lecture will tell me that little or no remaining coronal tooth structure is synonymous to something known as ferrule, right? Little or no remaining coronal tooth structure is synonymous with something which is known as ferrule in our language, right? Which is a bracelet kind of a thing, which is basically formed of the tooth which is remaining after your endodontic therapy. A high risk of fracture is there, and the tooth has to be, taken as an abutment in cases of FPDs, RPDs. The tooth will provide support to your, device after you're done with your endo. In such cases, the canal with circular cross section. Now, how do you decide कि कौन सी canal में मैं post डालने वाला हूँ, कौन सी canal में मैं अपने ये जो custom post बनाऊंगी या बनाऊंगा? So in such cases, the one canal which is circular and rounded and it is a little thick, it's a little wider, because in cases like these the failures are minimal and it is easier to fabricate a post. And definitely you will have to figure out ki damage kaun si side pe zyada hai, which is the side you can get a rule which is fine, and on those basis you will decide which in a multi-rooted tooth I'm talking about. Definitely it's a posterior. Prefabricated post with amalgam or resin composite followed by a full coverage crown. So I've taken enough time for you to, revise this lecture again. This was very important. You'll have to write it exactly, maybe draw it in your exam, exactly what all conditions you'd require root canal post, not in all the conditions. MOD, 3 walls, or the 4 walls, right? Depending on how much ferrule is there on the tooth. Considerations in restoring endodontically treated teeth. I described what are the differences that are present in cases of a vital and a non-vital tooth. When we talk about endodontically treated tooth, the tooth is absolutely non-vital now, right? So it has a, they say that moisture loss is there, the tooth becomes brittle as compared to vital tooth. Architectural changes I told you about, like how much strength is decreased in cases of MOD cavities, in cases of caries, trauma, access cavity, a faulty restoration already present. In such cases, you lose the strength, right? These are the differences between a sound tooth and a one which is endodontically treated. Biomechanical behavior, I told you that in case of vital tooth, we have something known as proprioceptive feedback mechanism. The tooth will obviously come under masticatory load, but soon after the load is gone, it will come back to, it has the elasticity, it will come back to its normal form again. But that is not true in cases of endodontically treated teeth. Biological width, it is underrated, but again, we need to have an absolute minimum width of 2.5 mm between the restoration margin. The one what prosto people do, they create a tooth margin and on top of it they provide the crown. So this margin has various principles to be followed. One of them, most important one, is the relationship of your crown with the periodontal health, right? So this width you have, which is about 2.5 mm, you have to respect it, and no restoration margin should be present around this area 2.5 mm. You have to respect the restoration margin, and the crest of the alveolar bone has to have 2.5 mm of biological width. And lastly, I've discussed enough about this thing known as ferrule. So let's quickly get you a slide which was not present in my last class. Ferrule is defined as a band of extracoronal material at the cervical margin of a crown preparation that encompasses the tooth and provides resistance form to the tooth. The word ferrule is derived from the Latin word ferrum, meaning iron, and variola, meaning bracelet. This ferrule effect occurs because of crown bracing against remaining supragingival tooth tissue. This is, just a second, there's a little noise in the background. Yeah, disadvantages of teaching at home. This is okay. Yeah, this is the slide which was not present in my last class. Please draw the diagram, most important. In the last class, I raised a question like, what are the dimensions of this ferrule? Like, what are the dimensions of this tooth structure already present? And you have to, you have to advocate, you have to study the crown structure before you can plan a post or before you can think of post and core procedures. So this is what I'm talking about. As you can see very beautifully in the diagram, the height of that ferrule should be 2 mm, minimum 2 mm. It can be, if it is 3 mm, well, it is amazingly good if it is 3 mm. But minimum eligibility criteria for you to go for a post and core is you need to have a 2 mm ferrule round the wall, around the wall of your crown. Then we have is what is the thickness, or in other words, what is the width of your ferrule. Minimum thickness of 1 mm should be there. Now, just listen to this, don't have to write it. A properly executed ferrule significantly reduces the incidence of fracture in endodontically treated teeth by reinforcing the tooth at its external surface, dissipating forces that concentrate at the narrowest circumference of the tooth. Now, this ferrule has a function. What it does is it reinforces the tooth, but how? It actually dissipates, it spreads the forces that are concentrated at the narrowest circumference. If you actually didn't have this width of 1 mm, these forces will just concentrate at this narrowest portion and eventually lead to fracture of your tooth. And that is the reason you require something known as ferrule before you plan a post and core treatment. This, I think this is a very this is quite enough for a third year student at this point. So if you remember all this, that's amazingly well. Let's move on to quickly to Well, yeah, I just told you about the differences or what, how do you plan in cases of non-vital tooth. Then I described what is a core to you, what all materials, where exactly, what exactly core does. It replaces the caries, and in no way your core and your crown are synonymous. As you can see in the diagram on the right, core is a different thing. Core is one which is below, which is underneath your crown. Okay, do not get confused between core and crown. Core is the thing that every रूट कनाल treated teeth requires. ठीक है, रूट कनाल किया किसी tooth के ऊपर, and then you have to provide a restoration before you can do a crown. So that tiny small restoration that you do after your root canal is known as the core. You might have seen, or you will be seeing in the coming future, that root canal करने के बाद we give a temporary filling to the patient. We call the patient the next week and then check on if there is pain, sensitivity, or any such thing. If nothing is there, then we do a permanent restoration of that tooth. After doing permanent restoration, we go for a crown. So in other words, that permanent restoration is what is known as the core of the endodontically treated tooth. So you, all the endodontically treated teeth will have core, but all the endodontically treated teeth might not have the post, right? Then I spoke to you about what kinds of posts we have preformed, which is like already commercially available sizes of posts in cases of circular, round canals. Aesthetic posts, the one which are used for anterior teeth, where the patient is quite concerned about aesthetics. These are also commercially available. The cast posts are the ones you have to fabricate yourself. You have to take a wax pattern, adapt to the flared canal, give it to the lab, and that's how it is made of metal. It comes, you do a try in, do a little here and there reduction, and cement it. Desirable characteristics, I told you, very easy. Common core materials, composite, amalgam, casco, GICs. Evaluation is like I've discussed enough about anteriors and posteriors in the decision making itself. Then anterior is done, posterior is done. Indications, obviously all of these teeth need, but where exactly do you need the post? In cases where there is extensive coronal loss, as you can see, this image has a post inside of it, and then there is a crown on top of it. To serve, if it is serving as an abutment, as you can see in this, the mesial root is having slight curvature, so we've planned it on the distal root where the canal is a little wider also. Primary function, what I've told you, like I think already 10 times, that post in no way will strengthen the tooth or the root. It will only strengthen what? The core. It will only support the core. Don't even use the word strengthen for post. Just say it supports the core. That is what. If we give a post in cases of indicated cases, post will actually support core and form of one assembly. It will just form one assembly, right? Principles of post. Now this is important, where we're going to actually start today's class. Post length already done. Length and shape of the remaining root determines the length of the post. As I asked you to note this down in the last lecture, in long rooted teeth, the post can be as long as possible without disturbing the apical gutta percha seal, which is of 4 to 5 mm. Why do we need to have this apical gutta percha seal? Is because a lot of lateral and accessory canals are there. If you disturb this seal, you will actually ruin the root canal treatment or the treatment that you've given to the patient. You will open up these lateral canals, accessory canals, and bacteria will start harboring again. In average to short rooted teeth, post length is determined by retaining 5 mm of apical gutta percha in order to ensure apical biological seal. It is desirable to extend the length of the post to at least 4 mm apical to the crest of the bone. As we were discussing about biological width, the same principle is applied here. This post length should be at least 4 mm inside the crest of the bone. ये जो bone है यहाँ पे side में, इसके अंदर bone आपका post, it shouldn't be very small कि वो side में जो bone है उसके अंदर जा ही नहीं रहा. It should at least be 4 mm inside the crest of the bone, like, okay. Then we have this beautiful diagram that you can use for your exam also. How do you describe? There are a variety of criteria to go for post length, but any of these has to be followed. SNA कि तुमने इसमें से कुछ भी फॉलो नहीं किया for your post length. Okay, depends on case to case. So one was saying कि crown, the length of the crown, जो उसकी actual length है crown की, your post can be actually the length of your crown also, or it can be 2/3 the length of the root, right? This diagram is very beautiful and very easy to understand. Please make sure you're drawing this in your exam. Coming from Grossman only, but if you're making it right away, it gets easier for you to prepare for the exam. Right, again, I have told you already that minimum apical gutta percha should be 4 to 5 mm. Okay, this is the ideal length of the post. As you can see, there is minimal apical seal has been respected, and on top of it, a custom cast post, a one which you made it by a wax pattern. You sent it to the lab, and this is like one unit which you've got from the lab, and you've done the try in and you've cemented it, right? Next factor is tooth anatomy. So please write down molar post should never extend more than 7 mm into the root canal from the canal orifice. I repeat, ये canal orifice है. Everybody knows. जैसे axis open किया, this is what canal orifice is. Canal orifice to 7 mm is the length of the post in cases of molar. इससे ज़्यादा extend नहीं होनी चाहिए. Chances of fracture and load will increase on the tooth. Then this is a very interesting slide. Please write down like what are the criteria for post diameter? कितना thick होना चाहिए? Length की बात तो हमने कर ली. We've talked about length like in the last lecture also and today also. Now what is should be the diameter or whatever you want to call it, the width, whatever, the thickness horizontally of your post, right? Let's just call it diameter. So there are three theories or three kinds of people who'd say three different things. So I'll get to you the three things that they say. So the first one is conservationist. Conservationist approach में क्या होता है? One with the please start writing, and you can also you have to draw the diagram. Conservationist approach जो होती है, it advocates minimal canal preparation. I repeat, it advocates minimal canal preparation and maintaining as much residual dentine as possible. It maintains as much residual, जो बची हुई dentine है root dentine side में, as much residual dentine as possible, therefore suggesting restriction of post diameter in an effort to conserve the remaining tooth structure. In other words, the one with the who follows the conservationist theory, उसका कोई dimension नहीं है diameter का, but what they say is minimal होनी चाहिए diameter की depth, because हमको side का जो dentine है वो बचाना है, root dentine we have to preserve. So there is no diameter, but you have to tell them that the name suggests conservationist, मतलब मुझे conserve करना है. The next approach is preservationist. The next approach is preservationist, wherein the post should be surrounded by a minimum of 1 mm of sound dentine. Now you have to draw this diagram कि side में post का diameter कितना होना चाहिए, कि इतना होना चाहिए कि मेरे साइड की जो टूथ स्ट्रक्चर बची है, जस्ट इमेजिन अ 3D स्ट्रक्चर ऑफ योर रूट एंड तुमने उसे क्रॉस सेक्शन में कट कर दिया, हॉरिजॉन्टली कट कर दिया. नाउ ट्राई टू सी the hole which is your root canal and the side width which is present of that root. When you try to imagine that, you'd know कि मुझे इतना dentine बचाना है 1 mm surrounding the entire canal or your entire post, right? So this is the theory for preservationists, that you have to have their post should be surrounded by a minimum of 1 mm of sound dentine. Next we have is the third theory, which is the proportionist theory. Right? In proportionist, very easy, as you can see. तुमने अपनी root canal को 3 parts में divide कर दिया. 3 parts में, right? And your any one of the part is the diameter of your post. Like 3 equal parts में divide कर दिया. So your 1/3 should be the diameter of the post. Very easy. Post width should not be greater than the root width at its narrowest dimension. This proportionist approach was advocated with the intent of saving sufficient tooth structure, right? So I've told you three different theories. Again, there's a you have the liberty in cases of post and core. Every clinician has the liberty to actually follow what is indicated in that particular case. Rule number 7. Yeah. So in post and core treatments, you have the liberty. You have to decide according to the tooth which is given to you. Am I clear? But these are the three theories you're supposed to write in your exam and know for yourself also. What all they have done on this subject and where all we're coming from. So we've given three theories: conservationist, preservationist, and proportionist. Let's move on. The third one is canal configuration and post adaptability. I hope you're able to relate. हम discuss क्या कर रहे हैं in the first place. We're discussing principles for post selection. You will not just randomly select a post कि ठीक है ये आ जाएगा ये adapt हो जाएगा. All these principles should be checked. You should have a checklist, check, and then you'll be like, okay, this is how I design my post. Be it a preformed or a prefabricated post, be it one with which you have fabricated using a wax pattern, or XYZ, be it an aesthetic post. You have to make sure all these checklist is completed before you're actually delivering that post. So the third one we have is, in fact, the fourth one we have canal configuration and post adaptability. If a canal requires extensive preparation, a well adapted cast post and core restoration will be more retentive than a prefabricated post that does not match the canal shape. I've discussed this before also. Yeah, roll number 7, I'm throwing you out of the class. Okay. Who is roll number 7? Anyone can quickly tell me? I'm looking for an answer from the CR or someone. Okay, so here I'm trying to tell you is canal configuration and post adaptability. I told you in my last lecture also that how do you decide whether you have to go for a preformed post or whether you have to go for a custom cast post or whether you have to go for an aesthetic post. Now, because of you disturbing in between, I have to, get to the rhythm again and again, right? So you have to, it all depends on the size of your root canal. It should match the size of your canal shape. Next we have is post design. Now, most important, start writing. You have to write exactly like this in your exam. This is quite annoying. Post design, like it is based on shape. You can have a parallel post, you can have a tapered post, or you can have both parallel and tapered together. Based on the surface characteristics, you have active posts and passive posts. Now, what are these active posts and passive posts? I'm going to cover in my next subsequent slides. The third one is based on fabrication method. It is custom cast posts and cores, prefabricated posts and cores, which are made of metal, zirconia, and composite. Please write down exactly how it is given post design based on the shape, based on surface characteristics, based on fabrication method. Let's discuss the parallel posts and are clinically recommended due to their better stress distribution and improved retention abilities. As you can see, parallel posts are clinically recommended due to their better stress distribution and improved retention abilities. Only tapered design that is clinically recommended is custom post and core. ठीक है, ये जो ऊपर वाले पोस्ट हैं जो कि पैरेलल पोस्ट हैं वो क्या करते हैं, क्योंकि ये टेपर्ड नहीं होते हैं, ये कनाल में ज़्यादा से ज़्यादा फ्रैक्चर नहीं कॉज करते, बहुत कम फ्रैक्चर कॉज करते हैं. एंड द नेक्स्ट स्टेटमेंट सेज दैट टेपर्ड डिज़ाइन वाले जो पोस्ट हैं दे आर ओनली रेकमेंडेड अगर वो कस्टम मेड है, खुद से बनाए हुए हैं, राइट. Active versus passive posts. See, it might be overwhelming to get to know so much of information in two classes when you were never, before this class or these classes, you were never introduced these topics, so you don't have to worry about it. All I'm trying to say is, take whatever you can understand and just write down the headings of whatever you cannot understand. That will sort out your answer, and whatever you're able to understand at this point is exactly how much you should be knowing at this point, right? So all I'm requesting you is just make sure you know the headings of this unit, and जो समझ में आ रही है चीजें वो तो आ ही रही है, like ferrule हो गया, why are we even giving post and core क्या होता है, post क्या होता है, what are the functions, what were the theories, what all approaches you can go for in endodontically treated, all these things are important for you. But things like these, how do you distinguish what posts are there? It is basically going to be torturous for you to understand the detail of it unless and until you practically do it. So just remember the names, that कुछ ऐसी चीज होती है, something which is active and something which is passive. So active post का मतलब ही यही है that it can mechanically engage into the dentine, right? With threading, ये जो तुम्हें ये ऊपर वाला post दिख रहा है, as you can see, it has serrations on the side, right? It has flutes on it. So it only means अगर मैं इसको डालूंगी canal के अंदर, it will definitely engage with the dentine, right? So active posts जो होते हैं, they have better retentive abilities but are clinically not recommended as they will decrease the fracture resistance. This is very simple, right? अगर वो dentine में engage होगा तो fracture resistance increase होगा कि decrease होगा? फ्रैक्चर रेजिस्टेंस इंक्रीज होगा, वो नहीं, सॉरी, डिक्रीज होगा, वो फ्रैक्चर को ज्यादा करने में कोशिश करेगा। कौन सा वाला पोस्ट? एक्टिव पोस्ट. Whereas the passive post, they do not have serrations, they do not have flutes, so that will derive its retention from the cement that you will be using after for luting the post inside the canal, right? Custom cast post and core. It is recommended whenever more than three-fourths of the coronal tooth structure is lost. Right? Preformed or aesthetic post जो market में available है have standard sizes you can pick and use it for your straight canal. But in case you have a definite three-fourths coronal loss, and you have to make sure that you produce or you fabricate a post which is absolutely of the same size of that you have the canal, right? Then you will have to go for something known as custom cast and post. As you can see in this image that I've got you, what they have done, they've made a wax pattern, given it to the lab, and उसने पूरा core के साथ में नीचे post बना के भेजा है, and this is how it looks like after cementation. The treatment is not complete. Now what we'll be doing after this, we will be taking a impression, sending it to the lab, and the crown will be formed, and you will cement the crown on top of it, right? Next we have is prefabricated post and core systems. I've already introduced you this, recommended when the loss is restricted between half to two-third of the coronal tooth structure. Now you know ये three-fourth loss में होना चाहिए, ये half to two-third coronal tooth structure loss में होना चाहिए, right? These are the like these are variety of preformed prefabricated posts available in the market. As you can see, aesthetics are also concerned. You've taken, they can be made of composite, they can be made of ceramic, they can be made of glass ionomers. A lot of things, a lot of materials are available in the market. Luting, now this is again important. You should just know कि luting करते किससे हैं, क्या क्या हम use कर सकते हैं. Just write the name. Look at this beautiful, case that I'm showing you here. तुमने क्या किया? You're using your electronic device to make sure your luting cement is, going evenly inside the canal, right? You can use a lentulo spiral, which is an instrument that we use in endo. You don't have to write the name, and you have dispensed the entire cement inside the canal before you're placing the post inside, making sure कोई भी hollow space ना रहे. Whenever we're placing the post inside, it is evenly distributed with the cement, because कभी ना ये थोड़ा बहुत जो cement होता है, even the luting cement will provide tad bit of retention to the entire process. So what are these luting cements? These are resin luting cements, glass ionomers. Which type one is a luting cement? You know that. Resin modified glass ionomer cements, zinc phosphates. Quickly I'm telling you what is in today. What is in modern endodontics? What are the practitioners using today? So they're massively using resin cements. They're not using any of these that I mentioned before. They're massively using resin luting cements. Now, why are they using resin? Just when you step in your dental practice, when you open your clinic, I'm sure you are gonna get resin cements for even for cementing your regular full coverage crown, तब भी तुम resin cements ही use करोगे. ऐसा क्यों है? Why are they so in? Because of their increased retention. They support to strengthen the root, although very little, but they do. They reduce the leakage. They will be more resistant to your masticatory cyclic loading. They have the ability to bond with resin-based posts to form one unit, which is the monoblock. See, just don't have to worry about it. As I told you, कि जब पोस्ट और कोर मिल जाता है then they form a one assembly like a monoblock. But if we have a custom cast post, the one we are making with the wax pattern, and it is formed in the laboratory, comes as a one unit which is your metal cast in post, तब तो कोई चिंता है नहीं. ये वाले इसकी बात कर रही हूँ मैं. Don't have to worry about it. But in cases where you're using an aesthetic post or a preformed post, then it is you who's going to design the core on top of your post. So you have to use a material which will become one with your post. And that is why resin luting cements also help you deliver that. So, the take home message or your conclusion or your summary of this lecture that you should remember and also write in your exam is one basic thing: you got to avoid any contamination that is happening to your root canal system. Because why do I say so? Because आपने root canal कर दी, your pulp chamber is still exposed. You need to have a strong core. You need to have a strong post endodontic restoration on top of it before you can go for any further treatment. Making sure you are absolutely isolating the tooth and then doing it. Just a second. Next we have to restore the tooth immediately after the root canal therapy. If there are patients that won't show up for 2-3 weeks, and then when they come, and then you have to decide करूं कि नहीं करूं. मेरे को I'm talking about patients who will get their root canals and you give them a temporary filling like you give in your conservative dentistry also when you're recalling the patient. So you do that, and then the patient promises that they will revert after 7 days, and he does not show up. And it's been 3 weeks, and he's coming after 3 weeks. His temporary filling is absolutely loose, and there is a lot of saliva which is inside the temporary filling. You know what that is? What has happened? A lot of micro leakage has happened. Now, in cases like these, you have to be very certain कि you have to be very confident also कि do I go for something like this, because इसके ऊपर तो मेरे को पहले पोस्ट भी देना रहेगा, कोर भी देना है, फिर क्राउन देना है. So it's a lengthy procedure that I have to do, making 100% sure कि टूथ के अंदर जो तुमने रूट कनाल किया है, जो तुम्हारा जीपी है, सीलर है, उनके बीच में माइक्रो लीकेज नहीं हो गया हो. You have to be absolutely sure. So a very good book in endodontics says that if your root canal is without a permanent crown for 3 weeks, 3 weeks से अगर ज़्यादा तुम्हें time हो गया है, then you got to repeat the root canal therapy. I know this sounds very strict, but that's how you got to think. 3 weeks बिना restoration के loose temporary filling के got to repeat the entire root canal therapy, right? Because your entire success, entire prognosis of that treatment depends on your filling that you did not give in time. Principal purpose of a post is to retain the core build-up. In no way the post will strengthen the root or the tooth. I've repeated n number of times, will not repeat any further. The rule is highly desirable when a post is used. You all already know by now. When post is needed, conserve as much radicular dentine as possible. You have to go back and think about the theories I told you or the approaches that we have: conservationist, preservationist, and proportionist. Lastly, got to retain minimum of 4 to 5 mm of gutta percha apically. The reason also I've told you n number of times. So this lastly, the most important, in most cases, the particular post system used is not as important as following the principles. I told you 3 kinds of systems: the preformed, the aesthetics, and the custom cast, right? सो इन सब पे इतना डिपेंडेंट नहीं है प्रोसीजर जितना इन सारी चीज़ों पे है, जो कि है द प्रिंसिपल्स ऑफ पोस्ट सिलेक्शन, which is adequate length of the post, adequate resistance form, adequate strength to allow the preservation of dentine, adequate ferrule, and all the other principles that I covered with you, right? This I already told you how to go about writing an answer of this question. Even if you do get a short note, if you do get a short note, the question will either be like short note, post and core, or it can just be like restoration of endodontically treated teeth. So I've given you enough information on this unit. But when you go into your final year, or maybe if you're doing residency in cons and endo, this question can come as a 20-mark question in your exam. Restoration of endodontically treated teeth. And believe me, whatever information I've told you regarding this chapter is enough for you to even write a 20-mark answer, right? The only thing that I haven't done is describe the inside of these, like what categories of posts are there. And I've even told you how to select a post, not told you about the materials, right? But that is way too much for you as a third year student. Now I'm going to do a little recap and I'm going to throw a few questions at you. These videos will be available at this. I've created a YouTube channel just to post my videos which are being recorded on Zoom. So the channel name is Dendrils with Hershey. You can go, even if you do not want to follow, you can just download, look at the presentation, make your own notes, and just read them when you all have exams coming up. So I'm giving you videos right there. So before start asking you various questions on this, I'm going to ask you if you yourself have any doubts or any questions. Shoot me up and just unmute yourself. अगर तुम नहीं पूछोगे तो मैं पूछूंगी. So it's good तुम ही पूछ लो. You will buy some time, right? Purushottam.
Ma'am, please repeat proportionist theory of
Okay.
cost.
Dan, can you please first name yourself? It's very difficult. You guys are just showing me your fans, so it's really annoying. I can't even see your faces.
Ma'am, Priyanka.
Okay. Okay. Thanks for the question, Priyanka. Let me have a sip of water. She's asking preservationist theory. Good that you were listening. That only means you were listening. Let's go back to this beautiful diagram I showed you. Preservationist, as you can see, Priyanka.
Ma'am, proportionist theory.
Okay, proportionist. Okay. Proportionist तो और भी सिंपल है, ठीक है? Proportionist मैं तुमसे ये क्वेश्चन बार बार पूछती रहती हूँ, हर बच्चे से पूछती हूँ मैं वो क्वेश्चन. What is the width of an amalgam cavity? Do I not ask you? Depth तो सब बोलते रहते हैं, right? Depth सब बोलेंगे. Depth तो सबको रटा हुआ है 1.5, 2 mm. Everybody's gonna say this. Priyanka, can you answer the first question? Quickly, we've got 9 minutes only. I have Priyanka, width of amalgam cavity.
Ma'am, 1/4 of the intercuspal distance.
Absolutely. Very well answered. 1/4 of the intercuspal. जो भी लोग ये कर रहे हैं, जो 1/3 बोलते हैं, वो सब बेवकूफ हैं. जो भी 1/3 बोलते हैं, क्योंकि तुम्हें समझना चाहिए 1/3 जो है, वो 1/4 से बड़ा होगा कि नहीं होगा? Right?
Yes, ma'am.
Right? And whenever we teach you amalgam, we definitely tell you differences between an amalgam and an inlay cavity. Whatever shitty book you refer to, whatever Nisha Gertz or whatever books you refer to, they always have the differentiation between an amalgam cavity and an inlay cavity, right? And after reading that difference between the two cavities, one thing for sure that you're going to extract is कि जो inlay cavity है और जो amalgam cavity है, दोनों एक दूसरे की opposites हैं. और अमेल्गम कैविटी नैरो होती है एज कंपेयर टू इनले कैविटी, राइट? इनले करते ही तब है जब ज्यादा वाइड कैविटी होती है, राइट? सो यू पीपल आंसरिंग बाय सेइंग कि 1/3 द इंटरकस्पल डिस्टेंस, इट ओनली मींस तो जो तुमने विड्थ बनाई है टूथ की उसको 3 पार्ट्स में डिवाइड किया है, ओनली 3, और ऊपर में क्या कर रहे हैं हम 4 पार्ट्स में डिवाइड कर रहे हैं, right? Do you understand, Priyanka? Let's how am I connecting this answer to this? The only reason I'm connecting is so that you can think what I'm doing in cases of proportionist. Not the cavity, but I'm trying to divide the root itself into. Just a second. Yeah. So, Priyanka, are you there? Somebody is
Yes,
really
ma'am.
noisy, please. Yeah. So, Priyanka, in cases of proportionist theory, what we're doing is the post width हम कैसे define कर रहे हैं या post diameter should not be greater than the root width at its narrowest dimension. उस narrowest dimension को भूल जाओ. When you look at the cross section of this root, तुम इसे horizontally cut कर दो एंड उसको इमेजिनरी आर्बिट्ररी 3 पार्ट्स में डिवाइड कर दो. ठीक है, सेंटर में तो रूट रहेगी और साइड साइड में डेंटिन रहेगा. ठीक है, तुमने 3 पार्ट्स में डिवाइड कर दिया और तीनों पार्ट्स जो है वो इक्वल होने चाहिए. इसका कनेक्शन थोड़ा बहुत प्रेजर्वेशनिस्ट थ्योरी से कर सकते हो, बट हर केस में नहीं कर सकते, बिकॉज प्रेजर्वेशनिस्ट थ्योरी क्लियरली बोल रही है कि रूट का डायमेंशन कुछ भी हो, एनी डायमेंशन यू गेट गिव मी एनी डायमेंशन और एनी रूट, but जो surrounding dentine है that should be surrounding root dentine should be how much, Priyanka, in cases of preservationist?
1 mm.
Absolutely. So now you know the difference between preservationist and proportionist.
Yes, ma'am.
Okay, thank you. Anyone else? Throw me up. Jaldi, jaldi, jaldi. Any questions? Quickly, otherwise I'll start asking. Quickly, we've got 5 minutes. Yeah, who's this guy, Amit Kumar? He's always not showing up his camera and he's got this really, I don't know. Amit, are you there? Amit. This is the second time I'm asking this guy. Tell him to speak with me or the management. I'm going to remove. Okay. Okay. Vishnu, are you there?
Yes, ma'am.
Okay, Vishnu, just answer me. If you get a question on restoration of endodontically treated teeth, तो तुम क्या लिखने वाले हो? Vishnu. विष्णु समझ आया क्वेश्चन? जो भी दिमाग में आ रहा है वो बोलो. Vishnu. Vishnu, will you answer or not? Just say yes or no.
No, ma'am.
Okay, don't waste my time then. Aarti, are you there? Aarti?
Yes, ma'am.
Yeah, kindly summarize the lecture for me quickly into 2 minutes.
Ma'am, firstly we have to done मतलब थोड़ा सा introduction लिखेंगे.
क्या
After
लिखेंगे?
that when introduction मतलब
चलो
कि
उसे छोड़ो. Just tell me the
जो भी
outline. Just tell me the outline. क्या क्या होता है इस यूनिट में?
मैम सबसे पहले तो वही है कि कहाँ करना है कहाँ नहीं करना, मतलब इंडिकेशन कॉन्ट्रा इंडिकेशंस.
Okay. और
फिर वो चार्ट बनाना है.
Kanishka, are you there?
Yes, ma'am.
Kindly summarize the class for us.
Ma'am, should I start with? Ma'am, first you described about. Ma'am, first you gave the introduction about the previous class. You explained it. Ma'am,
You're giving
ma'am, ma'am, then you told us about the how we have to write the question like introduction. We have to first write the introduction about this, and then ma'am, restorative decision making chart, then types of restorative material, then we'll have to elaborate the post and core.
Absolutely.
And ma'am, then you told us about everything. Like first you started with the ferrule and you added a slide in which there was actually the thickness.
Kanishka, can you tell me the dimension of a ferrule quickly?
Ma'am, dimension of the?
Ferrule.
Ma'am, it's the minimum thickness should be 1 mm.
Okay, thickness. And what should be the height?
Ma'am, 2 mm.
Minimum height should be?
2 mm.
Okay. Okay. Thank you, Kanishka. Dhananjay, are you there today also? Or you're just sleepy. Dhananjay. These guys, I'm just gonna complain about you people. This is the second class and you are not paying attention. Okay. So any questions from your side? मतलब तुम्हें सब समझ आ गया. This is what I get from you guys. सब समझ आ गया. Nisha, are you there?
Yes, ma'am.
Nisha, can you quickly tell me ki, what all kinds of posts are available? Types of post. Types of post. Nisha, yes or no? इतना अच्छे से पढ़ाओ और तुम ऐसे करते हो.
Yes.
बताओ फिर. जल्दी बताओ. पेजेस पलट रहे हैं अभी तो. कनिष्का, can you answer?
Ma'am, ma'am, it's written here, preformed, aesthetic, and caste type, caste post.
कास्ट पोस्ट. अब मुझे बताओगे कि कास्ट पोस्ट कब यूज करते हैं?
Ma'am, it is custom made or when you have to make them.
When the root is flared, when the root
Yes,
is
ma'am.
flared, like dimension है, वो round नहीं है. मम्मी को बोल दो दरवाजा खोलने. Don't go yourself, okay? So when the dimension of the root canal is round, then you can go for commercially available preformed. Right? Am I clear? I do know that it is quite overwhelming at this point to understand so much because I've introduced you to some massive information which was never ever before this class introduced to you, right? I get that point, and that is why Vishnu was not able to answer. I see that, and that is why I'm keeping this available for you for your use anytime before exams or whatever. Right? Any questions, you can just hit me up anytime. I'm ready to answer, even if you're not able to understand the entire subject today. What happens is when you're preparing for your exam, that's when you actually start reading in detail, and then a lot of questions might strike your head and you're like ये तो मैंने पूछा ही नहीं उस time समझ में नहीं आया. Everybody faces that, right? So if you have certain questions at that point also, please hit me up that time also. ठीक है? Is it okay, Purusharth? Purusharth is like just अब बस भी करो, पका दिया, right? Okay, chalo. I'm gonna end the class and possibly leaving this lecture by the end of today evening. May you can go and just check your class, download if there is an option. I'm really considerably new to YouTube, so might not be able to upload the subtitles or something. But you can just definitely go and check the video and make notes from there itself. Okay, chalo. You guys have a good day. Chalo. Take care. Bye bye.
Thank you, ma'am.
Thank you, ma'am.
Yeah, most welcome. Bye.
Thank you.